Hello, welcome, Dr. Miaken of Monarch Family Chiropractic, and talking to you this workshop on Monarch's chiropractic technique, our philosophy and how we render care, and the technique that we utilize to provide care in this office. And frankly, I think when you're looking at your healthcare team, it's absolutely vital that you understand the lens in which the provider is utilizing in which they render care, because we fall under an umbrella of what's called salutogenesis. And when you break that word down, it is the birth of health. Now, we're very different from our traditional healthcare system, which falls in an allopathic model. And allopathic is the opposite of salutogenesis. Allopathic is the study of disease and the rendering of treatment based on the disease, right? So when you walk into our office, and if you have headaches or you have low back pain, we are going to not look at you as this person has low back pain, diagnosis is low back pain, here's the treatment protocols related to low back pain goes away, and we're going to discharge you from treatment. We are looking at you as a being of health, and we want to understand what's keeping you from expressing your highest potential in your health and well-being, that where low back pain is showing up. So our assessment tools are going to be different, because our lens is based on health, and treatment is going to be, yes, short-term, but under the umbrella of care, because we want to care for and support your health and well-being. And oftentimes you find people in our practice who've been here for years, maybe decades, depending on the individual, because they're really looking at, I want to support my health and well-being over the long term. And so our philosophy in terms of how we render care is looking at health, right? That is the baseline. And what is keeping you from expressing your highest potential in health and well-being? So the WHO defined health in 1986 as the state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. And so understanding, again, our traditional healthcare system, which is based on the study of disease and the rendering of treatment to address that disease, you can see that doesn't fall at all within the definition of health. So when you're looking at health care, understand that when you're going to a doctor or a provider that falls within the allopathic model, our traditional healthcare model, it's really designed to assess disease and get rid of disease, right? Not merely the absence of disease or infirmity, but that's where they fall. So you're not really getting health care. So our philosophy, again, is based in health, and we want to provide health care over the long term. So how do we start? We always want to understand what is the baseline that you are functioning at. So we do a chiropractic exam that is meant to evaluate health. So we look at, are you presenting with subluxation? And subluxation is very specific to chiropractic. Okay, here is my spine model here. Okay, and down the center is that spinal cord. So that spinal cord is connected to your brain, and then you've got your peripheral nerve. So you've got your brain that travels down this highway, which is your spinal cord, and these exiting nerves that go to every parts and piece of your body. So if you have a subluxation, which is a malalignment in the spine that puts stress upon a nervous system, alters that information that the brain receives, impacting how you process your world. Okay, so we're assessing through our chiropractic exam to see, are you showing those signs of subluxations that impact the health and function of your brain and spine? Because if you are showing those signs of subluxation, then we know that's going to alter your expression of health, alter how you process your world. So number one, subluxations, when we're assessing for those, we take x-ray, because we want to look at, how is your spine aging? Based on what research has proven, is that our spine should maintain its structural integrity, should show no signs of wear and tear throughout our entire lifetime. Okay, so if we take an x-ray of you at 12 or we take an x-ray of you at 50, if you are taking care of your spine on a regular basis, there should be a very healthy spine that we're seeing. But unfortunately, we're seeing that's not the case. We live in a very unhealthy, stressed life and world. And oftentimes we don't know the importance of our spine until much later on in life. So number one, we're assessing your spine, and we do that by X-ray. We also do that through a chiropractic examination and ranges of motion, both general and very specific. And we also want to assess, how is your brain adapting to stress? So that's where we do scans. And these scans are really helping us identify how you respond to stress, how that stress is impacting different layers of your system. And so that is really the baseline of our exam. How is the spine aging, and how does it impact the brain and how the brain processes? And the third component, I would say, of our philosophy is education. And that is what you are, I guess, tuning into today, our spinal workshops. We know that there is not a lack of information. In fact, there is more information available to us at the, couple clicks of our fingers through Google. And yet we're no healthier than we were 100 years ago. In fact, we're in a more diseased state. So it's not about more information. It's about applying the information that's appropriate and having accountability through that time frame as you become healthier. And so we know people who show up and tune into workshops respond 30 to 70% more than those who don't. Because what are they hearing? As they're starting to get adjusted and experiencing an elevated state of health, they are hearing information that is tangible, that they are able to do to start making better decisions as it relates to all things health. And so that is why spinal workshops are really a cornerstone of our practice. Because if we are not educating you and supporting your more informed choices, then, what good are we really doing? Our founder said the subluxation, what is worse than the subluxation of the spine is a subluxation of between the ears. It's faulty thinking, poor thinking. So we want to help support you making better decisions, better processing, and making better choices. So what technique and what specialties do we have? So our chiropractic technique is to evaluate and detect and correct subluxation. So it's to understand, to know when to adjust and where to adjust. So every adjustment is very specific to that individual. And we want to make sure we have techniques that help us objectively measure where it's appropriate to adjust. So the techniques, and you can see in this parentheses here, activator is a technique. It also is one of the tools that we use in the practice to adjust. Corinne's specific technique, that is a technique that I practice, or shortened is called KST. Both Dr. Kristen and I utilize Logan Basic sacro-occipital technique, which is when we use the blocks or put the blocks underneath your pelvis. Webster is a specific evaluation for pregnancy. So those are the lower force instrument adjusting techniques that we utilize. And then we also provide adjustments by hand or a manual adjustment, and that's using the drops on the table. This could be considered Thompson, Gonstead. Dr. Kristen practices more Gonstead adjustments, and then motion palpation. So that just gives you some insight on how we're assessing you, because with each technique, whether it's Thompson or SOT or Webster, there are objective measures that we're using to understand knowing when and where to adjust. So, we can utilize different techniques and different adjustment types depending on where you are in care. Frankly, somebody who started getting adjusted 5 years ago is maybe getting different types of techniques and adjustments now than they did then, just to support getting different type of input within the body. And so we do use instruments to adjust in addition to our hands and the tables. So the activator is, I don't have one with me, but it just gives one quick impulse into the spine. So it's just one impulse. Now, some people will say, does that activator do anything? And they've actually done research to show with the activator, it's very specific input and force into a joint or into the body. And they've found that that activator can give the same amount of input in terms of force that a manual adjustment or an adjustment done with our hands can. It's just an adjustment done with our hands provides more force into a general area. I mean, we're very specific with our hands, but there's sometimes rotation or lateral flexion, sometimes a little bit more force that is introduced into the general area, not just the specific area. So it can feel very different. The arthrostim is the tool that gets plugged into the wall, and it gives repetitive input into the body. So it's da 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 da. And anytime a tool is used, what we're doing is stimulating what are called mechanoreceptors, and that's receptors that respond to pressure and touch. So when we locate a subluxation, we're using those tools to elicit a response from your brain by firing on those mechanoreceptors. And what happens is we're adjusting and correcting the subluxation. It's influencing the brain and the brain's understanding of what's going on in that area. And it is the brain that actually does the changes. So we have the arthrostim and we have the impulse in the practice that we use with both the same intent is to give repetitive input into the joint that again is very gentle and very specific. Okay, so we are a whole family practice. We love providing care to everybody in the family. And so I think our youngest patient who's been brought into the office has been a couple days old, and our oldest has been over 90. We love caring for the entire family. In fact, we have families, generations of families who are getting and receiving care. And it's a beautiful thing. You know, the first adjustment that I received was day 1 of life. My dad is a chiropractor. The first adjustment that my daughter received was day 1 of life. I checked her, and then also her grandfather checked her. And I can also speak for Dr. Kristen. The first adjustment that her kiddo received was day 1 of life. And so we've done extensive training in understanding prenatal care, pregnancy care, postnatal care, but also pediatric care and understanding brain development. And so we know that if the brain is getting good sensory information from the environment, from our environment at a very young age, as the brain is moving through development, it's going to move through normal, healthy development in the best of ways without those subluxations. Because again, subluxations influence how we process our world. And so if you have a kiddo who has a torticollis, right, if they're stuck in this posturing, they're not able to move, that means that what the brain is receiving is this is normal. Okay, and so their head is tilted, they're receiving the information tilted, and that's the information they're using to lay down good groundwork and architecture for brain development. That's one example. They're stuck in a posture, or if they're having abnormal movement, restricted movement. So we think starting care, the best time is now, and the earlier on in life is also the best time. And so we certainly see moms while pregnant, before they get pregnant, and then they also are bringing their kiddos in. And we understand chiropractic is supporting healthy nervous systems no matter what your age is. So we want to see vitality and you thriving, whether you're 10, 30, or 90. We've all seen and experienced people who are seemingly very young at an older age and seemingly very old at a younger age, right? So we want thriving and vitality no matter the age. So we are also a focus certified office. A focus certification is very specific pediatric care, understanding healthy brain development. If there are neurodevelopmental delays, if there are kiddos experiencing any type of spectrum disorders, we are trained and educated to handle those components. And then we also have done more seminars understanding trauma work, whether it's a kiddo or an adult. So we've done some more work around the polyvagal theory. and polyvagal tonal work to support trauma informed work. Okay, so again, continuing on with technique and specialties, we are focused. We X-ray everybody. When it comes to kiddos, understanding their history, their posturing, the chiropractic exam, we have X-rayed kiddos at 5, 6 years of age, but we utilize X-ray as a big objective measure to see and understand how your brain, or excuse me, how your spine is aging. And so corrective care is a big part of our practice, and we utilize corrective tools in your care. So first, in terms of corrective care, we're making sure with the adjustment you have good, healthy motion in your spine. Secondly, we want to introduce some active motion into your spine. So we do what's called spinal hygiene, and that's very specific exercises that we have you doing to start getting good motion and to prepare your spine for actual corrective work. And so when you get into spinal correction, and the reality is, if you want spinal correction, it is a minimum of a twice-a-week frequency. You can't really do the corrective work if you're not being seen at a high enough frequency to support a spine getting into that motion. But we utilize tools like a Deneroll or a fulcrum or a cerviguard, and a cerviguard is a collar that fits you and actually pushes you back into a healthy curve. A Deneroll, this Deneroll is something that you lay on. It is this very specific engineered piece that when you lay on this, okay, and for a certain period of time, you do it on a daily basis, that will actually correct your curve over time. So we find that if you have healthy curves and you have a spine that is mobile and flexible and able to adapt, that means that you have a spine that's aging in a really healthy way. And so one thing that we do as far as corrective care and continual evaluation is we do take X-rays, sometimes a year, sometimes 2 years, following that initial visit to understand how is your spine aging. We also do injury care. Sometimes people find us because they've been in an auto or work accident. I will say majority of auto accidents, yes, there are those that need to be in an emergency, need to be evaluated for some pretty acute injury that it is not right to be in a chiropractic office. Having said that, a vast majority of auto accidents are sprain strain in nature. And a sprain strain, think about it like a whiplash, right? You got a head going forward and then back, immediately injuring tissue, causing stress to a spine. Our healthcare system, outside of managing the pain, is not well equipped to support the healing of these types of injuries. And so if there is somebody who is in an auto or work accident, some type of whiplash accident, I would highly encourage you to refer them to a chiropractor to just be assessed. I find that we have people who we are the first stop for them, and their healing is, an accident is a terrible thing. I mean, it impacts your work life, your home life, your personal life, and your ability to just process and be and do the things you love to do. And having a good support system to take you through this process is really vital. And not having to turn to meds to really manage it, but it's not really addressing the healing process, and that's what you need. So I would say the majority of people who have been in an auto accident certainly should be referred to a chiropractor. And if you have friends or family who have experienced this, you need to refer them to us. You've experienced what we do here. You can trust us. If not, then we're happy to provide you with some referrals if that's the case. We also have people who experience injuries because they're sports related or a weekend warrior related injury. We work very well with that. And we do wellness care. So again, we have people who have been in our practice for years. And those people who have been in our practice for 5, 6, 7, 8, 10 plus years those folks are really what we consider wellness care. And those are people who are continuing to choose to receive chiropractic care because they want to be in the model of health, of salutogenesis. And we monitor those folks the same as we do corrective care, because we want to make sure that they're aging in the healthiest way, and what we're delivering here is supporting their goals and their objectives, right? Other modalities that we do, we do offer cupping. Dr. Kristen does do some cupping, but we also refer out for cupping. We do have a laser. Laser can help with pain management and also healing. So oftentimes that's utilized for more acute scenarios. We do have kinesiotape or K-tape application that we do. We have it available to help you support if there's an injury or more of a chronic use where you just need to support a shoulder or a hip or a knee. We can support you in that. There are some nutritional recommendations and supplementations that we make, and we also work with custom orthotics. The longer Dr. Chris and I are in practice, the more we're realizing the importance of your feet and your foundation and how that plays a role in what we call the kinetic chain, so the ankles to the knees, the hips on up. So we're finding that as a part of corrective care, we need to address what's happening at the feet. So we do work with a company, Foot Levelers, to provide custom orthotics for you. And then we also have pillows. We work with a great company that we take specific measurements, and it's almost a custom pillow for you. So sleeping posture is important. We spend a lot of time sleeping or in bed, so we want to make sure it's the best posturing for you there. So health goals, our healthcare goals, you have to really look at every decision you make. Every choice you make is either putting you towards health or putting you towards disease. If you think about pain, pain is really the tip of the iceberg. Pain is motivating. This is where most people are going to their providers, their healthcare providers, because they are in pain. But oftentimes there's a much deeper issue going on that we don't even realize or experience until that pain shows up. We oftentimes say pain or subluxation is similar to heart disease or cancer, because you don't know the impacts of them until much later on in life. And so we want to not only address what you're experiencing up here, but we want to address the deeper issue. And we find that when people get chiropractic care, the biggest celebrations are the misses, the things that you don't experience because you've been taking care of your body. So every life decision you make directs you towards or away from wellness. Question is, which way are you headed, right? The safety zone, that's feeling okay, not really noticing much. That is in a time frame where, how you feel is not a great gauge of how your health and your function, right? People with high blood pressure, people with cancer, right? Who get a cancer diagnosis today, but they felt fine yesterday. Did that mean the cancer wasn't there? Or did that mean that they just didn't know? And so we want to make sure that you are making consistent choices that are putting you towards wellness. And that's where we are a wellness-focused practice, wanting to advance you towards wellness and health and well-being over time and as you age, so that you are experiencing the most vitalistic state no matter your age, right? So we do have short-term goals. Okay, and then we have long-term goals. And the short-term goals really for us, it happens every 8 to 12 adjustments in the initial care. And that's where we're doing re-exams on a regular basis to really assess and understand how you're not only feeling, but how you're functioning. As you're under care longer, oftentimes we shift those re-exams to quarterly. But we really want to make sure we're assessing your function, because again, a lot of times you don't feel your function gets worse. It's until you're in symptoms where you notice, oh yeah, things have been getting worse. So we want to assess those on the regular. And this is where I'll end. Being healthy is a lot of work. There's no question. It is a lot of work to be showing up on a weekly basis, multiple times on a week, to do your spinal hygiene, to do your corrective care on a daily basis. It's a lot of work. It's a lot of investment in time and energy, money. That's a lot of work that maybe your colleagues or your friends or families aren't choosing to do. But I'll tell you what, being sick is a full-time job. And so you just have to choose your heart. You know, I'll end with this. I'm a chiropractic kid. I grew up with chiropractic care. It was something we did if I was sick, if I had an injury, if I just felt like I needed an adjustment. I thought that was normal. I was not the normal one, I found out. Not everybody got adjusted. And when something is so normal to you, you take it for granted. And in 2015, I started noticing over a 10-day period, I had lost sensation in the left side of my mouth, expanded to the left side of my face. And over the 10-day period, the left side of my body, I had slurred speech and double vision. My husband showed up at the office on Martin Luther King Day to take me to the emergency room to rule out stroke or an aggressive brain tumor or maybe a neurological condition like MS. We went to the emergency room, had a slew of tests done, was there for all afternoon, and they basically came back with an MS diagnosis. I had a brain lesion, my right midbrain impacting the left side of my body. My speech was so slurred that nobody could understand me, and they wanted to keep me there overnight, and I refused because I wanted to start the process of care, of addressing what's happening in my body and how can I improve my resilience to whatever was going on. So my husband called my chiropractor from the hospital, got me on the schedule. We drove from the hospital to my chiropractor who adjusted me. After that adjustment, my speech improved immediately by 50%. And that began my journey back to health. I did everything in my understanding of what is the salutogenesis approach to expressing a higher level of health. What do I need to eat? What do I need to think? How do I need to take care of my nervous system? How do I need to move as well as I can? I was confined to my bed for weeks. My husband had to get me dressed in the morning, had to feed me. I started getting adjusted every day. I went to acupuncture. I did life coaching. I got very clean on my diet. In the meantime, I went to a neurologist who diagnosed me with MS, said, we can try some, medications. We can try some, newer experimental things coming out, but you need to prepare yourself. We'll get you in for a spinal tap. You have one lesion. In order to have multiple sclerosis, you need multiple lesions. I had one, so I basically had single sclerosis. Went in for a brain tap, and I was slowly getting better over this 3-month period. Spinal tap came back negative. I totally resolved in terms of my symptoms in that 3-month time frame. And I'm considered a medical miracle. My healthcare provider and neurologist want to do all these tests to understand what's going on. And I said, no, thank you. I live in a world where when you start giving your body different tools, when you start supporting a healthier expression of health, then you can experience a different outcome. And so that's why I do what I do. That's why we choose to practice in this way, because if I was okay with being inserted into a system that assessed you as your disease and only looked at the outcomes related to that disease, then I could potentially be in a wheelchair right now. I may not have a kiddo. Who knows what my marriage would look like, or the caregivers that I would be paying for, or, asking my family to do. And that is what most people experience in terms of our healthcare. And we want more for you. We want more for you and more for your family. So thank you for trusting us to be a part of your healthcare and trusting us for whether it's your initial care or your years and years in. Thank you for trusting us. But more than that, it is such an honorable thing to choose and make a harder decision because it's right. Not because it's easy, but it's because it's right. So if you are here with us and you're a year in, or you're 5 or 10 years in, it is so honorable that you continue to make that choice, because our culture laughs at you or tears you down sometimes for trying to make a healthy decision, being committed to you. And so I appreciate you. Thank you for being here. And my ask is that you share what you know. The worst thing we can hear is, I wish somebody would have told me about this. Why didn't somebody tell me this about 5 years ago? I could have made some massive changes. And so that's my ask of you. Who do you know that you can share chiropractic with? You can share Monarch Family Chiropractic with, because we want to start supporting a healthier, more vitalistic community, and we need your help for that. So love and appreciate you, Dr. Miaken of Monarch Family Chiropractic, and we'll see you when we see you. Love to hear your feedback. You can either comment below, or you can fill out one of your takeaways when you come into the office. Thank you.